Take you back to Parliament because government says getting vaccines for babies is the topmost priority and is being treated as an emergency. Now, President Akufo-Addo waded into the vaccine shortage crisis while delivering his State of the Nation address on Wednesday in Parliament. Now, the President alluded to the severity of the problem, insisting that steps are being taken to resolve it. Now, it comes after hospitals nationwide reported a vaccine shortage. And for the lack of vaccines, forcing them to return babies who had come for short. Health Minister Kweku Agyeman-Menu earlier indicated that they are working to get the vaccines, but was unclear about the specific timelines.
We have had some vaccine shortages in the country since the last quarter of 2022. The vaccines in short supply are BCG, measles, rubella, and oral polio vaccine, OPV. This shortage is nationwide. The recent shortage in vaccines for measles, as regrettably as it is symptomatic of the steady global decline in measles vaccination since the beginning of the COVID-19 pandemic. And permit me to quote from a WHO recent publication on the subject that puts the challenge we are dealing with into perspective. And I will quote: measles vaccination coverage has steadily declined since the beginning of the COVID-19 pandemic. In 2021, a record high of nearly 40 million children missed a measles vaccine dose. 25 million children missed their first dose, and an additional 14.7 million children missed their second dose. A joint publication by the World Health Organization and the United States Centers for Disease Control and Prevention reports. This decline is a significant setback in global progress towards achieving and maintaining measles elimination and leaves millions of children susceptible to infection. And Ghana's Ministry of Health has been making efforts to ensure we secure adequate stocks of vaccines despite this global challenge. We have made all necessary efforts to ensure that despite these challenges, we secure adequate stocks within the next few weeks. It is important to correct the erroneous impression that there have been deaths from measles in Ghana recently, for the avoidance of doubt.
In the State of the Nation address in Parliament Wednesday, the President admitted he was worried about the situation but could not give specific timelines. He, however, assured the government is prioritizing acquisition of the vaccines.
The current shortage of some childhood vaccines in the country has concerned me greatly. This shortage, if prolonged, will affect negatively Ghana's childhood immunization program, which has been recognized as one of the most successful in the world. The WHO has only recently expressed worry about a steady decline in measles vaccination coverage globally because of the concentration on the fight against COVID-19. In accordance with our desire not to become part of this global trend, government has taken steps to ensure the stocks of these vaccines are procured and supplied as a matter of urgency and emergency. The Ghana Health Service has developed an elaborate program to catch up on children who have missed their vaccine immediately stocks arrive. Mr. Speaker, I want to encourage all parents and caregivers to ensure that eligible children are vaccinated once this program begins. No child should be denied access to vaccination.
Meanwhile, pharmacist and CDD fellow Dr. Kwame Sapon-Asiedu has blamed the shortage of the vaccines on lack of planning and commitment by government.
It's not like the the Ministry of Finance releases the money in bulk to the Ministry of Health. It comes in small quantities. So anytime they get the money, we are losing anyway when we are going to pay the people who are supplying us with the vaccines. So we cannot buy the amount of vaccines we projected to buy. That's the first thing. The second thing is, because these manufacturers projected slightly lower and other countries have put in bids, when you go, originally what they used to do was, when they do their projections to manufacture, they would put what we call an overage on it. That's a small quantity just in case uptake goes higher. In that case, if a country says bits late and comes in for supplies, they have some stock that they can give you. On this occasion, they've not done that because the trend is going downwards. So they are erring on the side of caution in manufacture. And that is why you hear the health minister say in the next few weeks. If you remember when this started, they said it will be sorted in 2 weeks. Now they're saying in the next few weeks because the manufacturers cannot give them an accurate timeline because their manufacturer is to people who have already placed their orders.